With that, we will move on to the final speaker for our webinar. That is Susan Anenberg, who's returning to talk about the work that she did on the health impacts of real-world diesel NOx emissions. And so Susan, who undertook the modeling impact assessment for this study, will give us some insights on the methods and the results. And after Susan finishes and we take the last questions, we'll be ending the webinar. So Susan, if I can hand it over to you for your piece on the health impacts.
Sure, thanks, Ray. So let's just jump into the next slide. So I wanted to give a little bit more detail on the health impact analysis methodology. As I mentioned previously, we followed the Global Burden of Disease study, which is run by the Institute for Health Metrics and Evaluation at the University of Washington. So this methodology is a state-of-the-science methodology used in a variety of different studies. It's also a similar kind of framework that's used for the United States and European assessments and elsewhere to examine the health risks of air pollution for policy development. So in a way, this methodology has been developed over decades in regulatory contexts, and recently it's been extended to global scales as well. So to do this, we combine information from different sources on ozone and PM2.5 concentrations for each scenario, which are gridded and developed from the geochem model that Devin showed. We combine that with global population in 2015 and in 2040, which is also gridded at a fine resolution. And then we also combine it with these disease-specific incidence rates in 2015 and in 2040. So how many people each year are dying from stroke, ischemic heart disease, lung cancer, and chronic obstructive pulmonary disease, for example. And those we have at a national scale for every country of the world. And these different data sets are included in a concentration response function. And actually, we use several concentration response functions for ozone and PM2.5. And the shape of that function relates the exposure levels, so the exposure to ozone and PM2.5 concentrations, with some health risk of the health outcome. So we actually use several different concentration response functions for ozone and PM2.5 for each health outcome. And as a result of this methodology, we get the change in air pollution related deaths for each scenario, which again is gridded. So the ultimate outcome of this framework is that we input a change in NOx emissions into the geochem global chemical transport model. And we then use the simulated concentrations in this concentration response function to get a change in ozone and PM2.5 related deaths. So next slide, please. As I mentioned, I forgot to go into a little bit more detail about the shape of the concentration response functions. I'm just going to really briefly touch on this. This is the shape of the concentration response functions that we used for PM2.5. These are called the integrated exposure response curves. These were developed for the Global Burden of Disease study in 2010. And they include information, epidemiological information from outdoor air pollution, household air pollution, environmental tobacco smoke, and cigarette smoking, all on the same curve to be able to generate this full distribution of relative risk estimates for different diseases across the entire range of PM2.5 concentrations that could be encountered. So you see here different curves for different health outcomes, including IHD, ischemic heart disease, stroke, chronic obstructive pulmonary disease, lung cancer, and acute lower respiratory infection. And a key factor of these studies is the shape of the curve. So you see that, for example, the stroke and ischemic heart disease curves, the cardiovascular health outcomes, substantially flatten out at high concentrations over, say, about 70 to 80 micrograms per meter cubed is about where the inflection point is. For COPD and lung cancer, those curves are more linear across the full range of concentrations. And for acute lower respiratory infections, that curve also flattens at very high concentrations, but here it's at extremely high concentrations, seen only in very extreme circumstances, usually indoors where households are burning solid fuels for cooking and heating indoors. So a key factor of the shape of these concentration response curves is that a unit change in exposure to PM2.5 in relatively clean environments leads to a greater health impact than the same unit change at very high concentrations. And that's driven largely by the cardiovascular curves, which flatten at high concentrations. So in the US and Europe, which are relatively clean atmospheres relative to some of the other places around the world which have very high pollution levels, the sensitivity of the populations to PM 2.5 is higher at those lower concentrations. Next slide, please. And I also wanted to reiterate the fact that our results are likely underestimating the true health impacts of diesel NOx emissions for a couple of reasons. One is that premature deaths are only the most severe health outcome associated with ozone and PM 2.5. And I'm showing here again the pyramid of effects of air pollution, where a larger portion of the population is affected by the less severe health outcomes. So if we were able to quantify those less severe health outcomes, we would be able to provide a more complete picture of the health impacts of diesel NOx emissions. Another key factor, which we touched on earlier, is that direct exposure to NO2 can lead to aggravated asthma and other respiratory diseases and a variety of other ailments. And so our exclusion of NO2 to follow the global burden of disease methodology is also likely leading us to underestimate the true health impacts of diesel NOx emissions. Next slide, please. So this, moving on to the results, this graph shows the premature deaths from all diesel NOx emissions in 2015, shown in the blue, and 2040, shown in the orangish red. We estimated that over 100,000 air pollution deaths result globally each year from on-road diesel NOx emissions. So this is all on-road diesel NOx emissions, with most of the impacts coming from China, Europe, and India. In 2040, that's likely to increase substantially. We estimate about 175,000 air pollution deaths annually around the world from on-road diesel NOx emissions in 2040. And that's largely driven by growth in China if China does not implement Euro 6 standards, particularly for heavy-duty vehicles. Next slide. Now, this is showing the 2015 numbers that I just showed, but broken down by what is essentially allowable under the current emission limits, is shown in the black portion of each bar. The portion of diesel NOx, the impacts of diesel NOx emissions from excess heavy-duty vehicles, shown in the from excess diesel NOx emissions from heavy-duty vehicles, shown in the pink, and excess NOx emissions from light-duty vehicles, shown in the orange-red color. And the first thing to point out is that for most regions, heavy-duty vehicles, excess emissions from heavy-duty vehicles really dominate the total impacts of excess diesel NOx emissions. The only exception to that is in Europe, which has a very large market share of diesels in its passenger fleet. In Europe, we calculated about 28,000 deaths from all diesel NOx emissions in 2015, and over a third of those were from all excess diesel NOx emissions, so those emissions that are in excess of certification limits. Over half of the excess diesel NOx impacts in Europe were from excess light-duty diesel NOx emissions. In the United States, this is a contrasting situation where we had 3,000 deaths from all diesel NOx emissions. About a third of those were from excess diesel NOx emissions. And the vast majority of those excess diesel NOx emissions were from excess emissions from heavy-duty vehicles as opposed to light-duty vehicles. So there have been a couple studies estimating the impacts of the Volkswagen scandal in the United States. And our results for light-duty vehicles, for the impacts of excess NOx from light-duty vehicles, are relatively similar to those previous estimates. But the impacts of excess NOx from heavy-duty vehicles are about 10 times as large. And so heavy-duty vehicles really needs to be a consideration for reducing the public health consequences of excess diesel NOx emissions. In China, it's sort of a similar situation to the United States, although much larger in terms of magnitude. About 31,000 deaths from all diesel NOx emissions, about a third of those from excess diesel NOx emissions, and the majority of those excess diesel NOx emissions, the impacts of those excess diesel NOx emissions are from heavy-duty vehicles as opposed to light-duty vehicles. Next slide. We also modeled, as you've heard earlier, the improvements that could be made with more stringent diesel NOx emission policies. And so here, if all of these 11 regions implement next generation standards, which are more stringent than Euro 6, we can avoid approximately 174,000 PM 2.5 and ozone-related premature deaths in 2040 with those NOx regulations in these 11 markets. And that's nearly eliminating the impacts of real-world diesel NOx emissions in those 11 markets. It translates to about 2% of PM 2.5 deaths globally and about 7% of ozone deaths globally and about 3 million years of life lost. In terms of the different policies that could be implemented, you see with the global bar at the bottom here, over half of the health benefits of implementing next generation, more stringent next generation standards could be achieved simply by implementing Euro 6 standards were not yet implemented. And that's shown in the green sections of the bar, with most of those benefits of implementing Euro 6 coming from Euro 6 for heavy duty vehicles, and largely driven by China. If you look at the bar for China, most of the health benefits of implementing Euro 6 comes from implementing Euro 6 for heavy duty vehicles in China. For light duty vehicles shown in the purple and light blue, the health benefits of implementing strong real driving emissions programs can get almost all the way to the health benefits of implementing strong next generation standards. So of course we would see some additional benefits from lowering the standard coupled with effective compliance procedures, but just implementing strong real driving emissions programs would be really quite effective at reducing real world diesel NOx emissions with Euro 6 standards. Next slide. Now, if you look at this on a percentage basis, so this is now showing the percent of the total burden of disease from ambient air pollution that could be avoided with these diesel NOx emission policies. Next generation standards reduce regional PM 2.5 and ozone mortality burdens by 26% in Mexico and about 22% alone for Euro 6 standards. And so here, this is essentially normalizing by population. So in the previous graph, you saw China really standing out. When you normalize it by population, as shown in this chart, we see Mexico really popping out, and Brazil as well. In Europe, about 7% of the mortality burden from outdoor air pollution could be avoided with more stringent next generation diesel NOx emission policies. Next slide. So just to reiterate the policy implications that I led off with, for heavy duty trucks and buses, implementing Euro 6 where not yet adopted, such as in China and Brazil and Mexico and Russia and Australia, is a key next step. And for light duty vehicles, strong real driving emissions programs can make Euro 6 and similar standards more effective in real world driving. So Euro 6 is not performing as well as Euro 6 for light duty vehicles is not performing as well as Euro 6 for heavy duty vehicles. And so here we can make Euro 6 for light duty vehicles much more effective under real world driving with strong real driving emissions programs. And then adopting and enforcing more stringent next generation standards, more stringent than Euro 6, can actually nearly eliminate real world diesel NOx emissions and their associated health impacts in these 11 markets. And that concludes my portion.
We have one question, Susan. It relates to the way in which you model health impacts and then calibrate that against what the actual deaths are that are occurring in the real world. So perhaps you can comment on the ways in which you're utilizing data that tells you about how many deaths are actually occurring in the world, and then using that to inform your modeled impacts of deaths we can attribute to these emissions.
Okay, sure. Yeah, the actual deaths that are occurring in the real world are an input to our methodology. So if you think back to the graphic that I showed at the beginning, where I had the cause-specific disease rates for each country leading into the concentration response function, those are our best estimates of how many people are dying from individual causes in each country. And so we have hard data for most countries of the world. Where countries do not have hard data, those were generated using the data that were available by the Institute for Health Metrics and Evaluation, again, for the Global Burden of Disease study. So what we were trying to do is just figure out what portion of those real world deaths are attributable to diesel NOx emissions. And here we relied on those epidemiologically derived concentration response functions. So for a change in PM 2.5 or in ozone, we know some, based on what these epidemiological studies have found over the course of the past decades, we know the effect that change in PM 2.5 and ozone has on cause-specific mortality in different locations. And that's how we relate the real-world deaths to those that are attributable to diesel NOx emissions.
That's great. Thank you, Susan. And with that, I'd like to just provide everyone contact information for each of the presenters today. You can all see links to the article online, as well as some supplementary info and data files for those of you interested in using the data, some of the input data that was developed for this study. The supplementary info also contains a much more detailed write-up, for example, of the development of the emission factors for different vehicle modes. A recording of this webinar will be posted online at our YouTube channel, and the link is there. And the slides will also be available on the ICCT's website. So with that, I just wanted to thank all of our speakers today for presenting the work that they've done. You can be sure that the ICT and our research partners here will be continuing to investigate this topic in the near future. So with that, I want to thank you all for participating today, and I will now close this webinar. Thanks all very much, and have a good day, everyone.